Hi, my name is Dr. Rajesh Shawn. I'm a gastroenterologist with Baylor Scott White. Today we're here to talk about bloating. Sometimes bloating can be a benign thing, but other times it can be a marker of a serious condition. We're here to talk about it today so that we can live well. Abdominal bloating is where gas builds up in the intestines. This can be perceived as either distension of the abdomen, so visibly seeing something, or kind of a fullness feeling. This typically comes from diet, so drinking things like carbonated beverages, or sometimes eating particular foods such as beans, cabbage, or even broccoli. There are certain medical conditions that can cause bloating, such as celiac disease, inflammatory bowel disease, irritable bowel syndrome, gastroparesis, or even things like small intestinal bacterial overgrowth. Additionally, sometimes patients can have food sensitivities or food allergies, such as a dairy intolerance or difficulty digesting foods that are called high FODMAP foods that can lead to symptoms. It's probably a good idea to see a doctor about abdominal bloating if you have particular what we call red flag symptoms. These could be things like unintentional weight loss, vomiting, or a family history of cancer in the intestines. Additionally, if you've already tried making diet changes and continue to have symptoms, it's probably a good idea to see a doctor. If you've already tried diet changes and you continue to have bloating, you could sometimes use over-the-counter medications like simethicone or Beano, which can sometimes help. If you have a chronic medical condition, then it's probably a good idea to see your gastroenterologist because they may need to adjust your prescription medications or perform other tests such as an upper endoscopy. Additionally, if you have food sensitivities or food allergies, we may consider dietary elimination or seeing an allergy and immunology doctor for further testing. Finally, we might consider trying probiotics for a limited amount of time under our supervision.